The recent disappearance and reappearance of crucial public health information from several federal government websites has ignited widespread concern regarding the Trump administration's potential efforts to censor or manipulate vital health data repositories. The erratic accessibility of these resources highlights a deeply troubling trend, raising questions about the future of public health information dissemination and access. Between Friday and Tuesday, a significant portion of the Centers for Disease Control and Prevention's CDC website, a cornerstone of public health information, experienced intermittent outages and content alterations. Resources dedicated to HIV tracking, prevention, and treatment, sexually transmitted infection, STI management, and contraception access were rendered inaccessible or presented only skeletal information for extended periods. The fluctuation in availability created chaos and uncertainty, leaving healthcare providers and the public grappling with unreliable access to critical information. Further exacerbating the situation, a comprehensive guide to gender-affirming care for young people, previously hosted on the website of the Office of the Assistant Secretary for Health, vanished entirely. This removal is particularly alarming, given the vulnerable population it served and the crucial guidance it provided. The disappearance of this resource is indicative of a wider pattern of seemingly deliberate actions to curtail access to sensitive health information. The National Institutes of Health (NIH) website, specifically the Office of Research on Women's Health, suffered a similar fate. Pages dedicated to supporting women in biomedical careers and women's health funding opportunities, present as recently as January 25, were abruptly deleted. A portal focused on maternal morbidity and mortality, a critical area of public health concern, also disappeared. The removal of this data not only limits access to vital research information, but also hampers the progress of critical research projects. The impact extends beyond the immediate loss of information. The CDC's Youth Risk Behavior Survey, a decades-long study providing invaluable insights into the physical and mental health of American youth, was significantly truncated, with considerable portions missing for days. This data loss poses a severe setback for researchers studying adolescent health trends and developing effective interventions. Similarly, the CDC's Social Vulnerability Index, a powerful tool leveraging Census Bureau data to assess community vulnerability to natural disasters, was also unavailable. This index, which uses factors like race, education, and income to assess vulnerability, is crucial for effective disaster preparedness and response. Its absence leaves communities at increased risk by hindering the ability to anticipate and respond effectively to emergencies. The repercussions of this information blackout extend internationally. Nancy Krieger, a professor of epidemiology at Harvard's T.H. Chan School of Public Health, aptly highlights the global implications, stating, "This has international ramifications. It distorts the science base. Science is disappearing from U.S. websites. The work of government-sponsored science is disappearing. The datasets are disappearing." A New York Times analysis revealed that approximately 8,000 pages from over a dozen government websites were removed, although some have since been partially restored. The CDC and Census Bureau websites, however, remain significantly impacted. As of Tuesday, Census.gov remained largely inaccessible, further underscoring the extent of the disruption. The NIH also removed information about a 2022 workshop where Krieger discussed the importance of considering both sex-linked biologies and gender complexities in scientific research. This work is crucial for ensuring appropriate inclusion and representation in scientific studies. The removal of this information represents a significant blow to the advancement of inclusive research methodologies. The Youth Risk Behavior Survey, despite its significance, faced criticism in several red states, with some states, including Florida and Idaho, withdrawing participation. Florida officials labeled the study inflammatory and sexualized, opting to replace it with a drastically simplified version that focuses heavily on abstinence. This illustrates the broader political forces that are shaping and limiting access to public health information. The sudden disappearance of websites and datasets prompted immediate action from researchers and journalists who embarked on an urgent effort to preserve the information using the Wayback Machine. Harvard researchers launched a datathon to salvage as much data as possible, highlighting the desperate measures required to safeguard vital information threatened by systematic removal. This deliberate removal or alteration of public health information not only undermines the public's right to access vital healthcare information, but also actively impedes scientific progress, compromises disaster preparedness, and exacerbates health disparities. The lack of transparency surrounding these actions raises serious concerns about the motives behind these decisions and their long-term consequences. The situation demands immediate attention and a thorough investigation into the reasons behind these actions and their implications for public health. The ongoing instability and the potential for further censorship raise deeply troubling questions about the future of public health information accessibility in the United States.